Health. I'm Dr. Amy Young. I'm the Executive Director of ABOG. And I'm here today to have a candid conversation with two amazing leaders in obstetrics and gynecology. And so rather than introduce my guest, I'm going to let them introduce themselves. So Dr. Gosman?
My name is Gabby Gosman, and I'm an Associate Executive Director here at ABOG. I'm the Chief of Medical Affairs, and I am also the Vice President for Medical Affairs at UPMC Magee Women's Hospital in Pittsburgh.
Dr. Kim?
I am Kenneth Kim. I am the other Associate Executive Director and the Chief of Medical Practice and Certification Innovation. And I am a professor in G1 Oncology in the Department of Obstetrics and Gynecology, now at the University of Texas Southwestern.
So thanks so much for being here today. Welcome to the podcast. I think this is the first podcast you've done with me. And we're here to talk about professionalism and appropriateness in the workplace. And there's been quite a bit in the media about issues that have been occurring in the workplace, and medicine is a particularly stressful workplace at times. And so it leads to, I think that stress leads to problems with professionalism and appropriateness. And if you think about healthcare delivery, it's really a team sport. You have the staff, you've got the provider, the patient's part of the team. You often have other colleagues that are involved in the patient's care. So I wanted to sort of delve into that, one interaction at a time. And I'd really like to start talking about the patient-physician interface and what does that look like? What does professionalism look like to you? So Gabby, can I start with you on that one?
Yeah, I think in thinking deeply about this one, I really realized that all of our physician colleagues seek a connection with their patients to have a healing relationship. And many of us really formed our techniques for forming that relationship really early in training. We developed ways of establishing connection quickly because we're in a quick specialty. And where things can kind of go sideways is that we need to evolve those methods of forming connection as the decades go on, as our patient cohorts change, as their sensibilities change, and evolve those. And so if you use a method for connecting with someone that really worked great 20 years ago, it may not work as well, even though your intention is absolutely the best. You really care for that patient. You want to show that caring. That 20 years ago approach can actually look kind of confusing to that patient, and at worst, it can look unprofessional. So I feel like really important for us as physicians to really continually think about updating what do our patients want as we form that connection and trying to match that.
It seems like that what I've watched develop over, the last 3 decades has been more and more sort of anonymity for the patient in those interactions. You have an electronic health record that's between you. You have the ability to chat back and forth, and while those mechanisms are mechanisms that are great for conveying information, they're not always great for conveying feelings or really your sense of responsibility and duty that you feel towards a patient and towards that relationship. You have any thoughts about that? I mean, does it mean we need to be extra special careful in those relationships and really take advantage of the time that we get to spend one-on-one?
I think that is such an important point to acknowledge. And we also cross-cover for each other a tremendous amount. And so deep-seated into every interaction where we touch a patient has to be a moment where we're seeking to understand or being curious about that patient or trying to tailor things specifically to that patient. But you obviously have to be really careful about how you do that.
I think the one word that you just said that really resonated with me is curiosity, right? Curiosity is, I think it's just such a powerful factor in learning about your patient and all those aspects. It's probably a central tenet, even though I've never really thought about it, of shared decision-making, right? Because if you're not curious about whether the patient can, follow the treatment care plan or any of those things, it doesn't. Without having curiosity, you really just can't have a full patient-physician relationship.
Yeah, agreed.
So Dr. Kim, let's talk a little bit about the staff, right? So there's lots of people that are involved in the care team that we might consider staff, right? It might be your nursing staff. It might be your front desk staff. Can you talk a little bit about what appropriateness looks like to you as far as day-to-day interactions with, those individuals that play really vital roles in the care of patients?
I think ultimately all of us went into this field to help patients, and they come to us with sometimes very serious problems, and maintaining professionalism is of the utmost importance to develop that trust with our patients. And part of that, as physicians, we're often the leaders of the team, of the clinical team, from whether you have a resident team or a fellow team, from your nursing staff to the patient care assistants, to the people at the front desks, and even to the people cleaning the rooms. And everyone has a responsibility and a role in taking care of patients, and how we communicate in and amongst our teams is seen by the patient and everyone around us. And if we are not professional in those interactions, it just degrades the trust in the team and our ability to function as a team, let alone as, an attending physician in a teaching environment. There's students, residents, sometimes fellows that are looking up to you and role modeling after you. And so a lot of this professionalism and how you treat every person at every level of your team is critical for teaching that for the future generations. I think some of that has been lost with the increasing use of instant messaging, social media, and all of the digital aspects in our everyday lives now. It's really easy to text, but through that, it's very easy to also get misunderstood with emotions or things that you didn't mean through words on a screen, whereas face-to-face interactions and those types of conversations are much more critical a lot of times. Certainly when we talk to patients, we get a lot of information by talking to them, and not just staring at the screen, but seeing what's going on with their body language, how they interact even with their family members or other aspects in that interaction. And I think some of that has been getting lost in recent times, and especially compounded by the pandemic.
I think everybody wants to feel valued in the healthcare team, right? Their contribution matters, and their contribution may not always be the same, and it may not be perceived or valued by the patient as the same. But I think that's always been helpful to me in managing teams, is trying to recognize and acknowledge the value that each one brings to the patient. Can you, either of you, think about a time where you saw less than professional behavior and you had to diffuse it, and how you managed that?
Oh yeah. I personally, like, people who've worked with me know that I critically value everyone in the operating room, and it takes everybody to get a case going. Anesthesia has to see the patient. The room between cases has to be cleaned by another team. There's just so many critical pieces. The instruments have to be cleaned and sterilized. There are so many critical parts that the patient doesn't see, and even the residents or the other team members that are on your team, those people may not see. And so people that work with me, I will help clean the rooms. I will help move dirty instruments to where they need to go to get sterilized, just to show some of that appreciation, but to also understand what they go through, but to also kind of propagate to the future generations that there's all these other behind the scenes things that happen that are critical to the process, because if the room isn't clean, your case isn't going. If the instruments aren't sterile, your case isn't going. If anesthesia isn't ready, and if they're finishing up with the last patient, your case isn't going. There's all these critical variables that other people are handling kind of on your behalf and to help you get your job done, that are totally unacknowledged day to day.
I think also a lot of what looks like unprofessional behavior in the workplace is a misunderstanding. And so I'll find myself frequently sharing the counterpart's, probably what's behind the counterpart's behavior, and trying to make that more transparent. And as I think back, I want to share a story. I had a resident who received the most amazing 360 evaluations. Like, she was just an outlier for how incredible these were. And in one of our one-on-ones, I said, how do you do this? You're amazing at it. And this has always stuck with me, but she said, I always assume good intent and walk into every interaction with that, because by and large, it's really true. Almost everybody is there to do good together. And there's so many competing demands that there's so many good things we're trying to accomplish. We may just be pushing for different good things. And so that lesson has just really always stuck with me. So a lot of times when I'm counseling someone on their behavior, things like that, I'll actually resurrect that resident's point of view.
That's always a great approach. You know, sometimes even, sometimes there is a level of accountability that we have to demand and expect, right? And sometimes people's performance, they may have a bad day. It may not be a good situation, and you have to actually address that performance issue with them. I've always thought it was important to, pull them to the side and basically give them feedback in a way that I would want to receive it myself. Do you have any experiences along those lines that are memorable to you?
Yeah, I mean, so many experiences. And I think what's so interesting is different people take feedback in a different ways. So I'm going to go back to what you said earlier, which is I will frequently start with some level of curiosity. Now, we've already established in this scenario the behavior was out of bounds and not appropriate. So I'm not curious in order to forgive that, but I'm curious about where they're coming from, what's going on, what's the context, because that's going to help figure out the solution. So in addition to making it clear that you were out of bounds, a lot of times the solution arises from what they'll share about the context, whether that is employee assistance because there's something else going on I'm not an expert in, and far be it for me to try to think about that, or more education or mentorship or more accountability where they're checking in with me more frequently. So that's an example that I can think of.
That's great. Let's shift gears a little bit. Let's talk a little bit about collegial interactions between physicians, between providers. You know, people have a myriad of different viewpoints and understandings and different lived experiences. Sometimes, and there's also, I always like to say there's more than one right way to do things, and then there's sort of my way, right? Those are not mutually exclusive. Can you talk or elaborate on a time perhaps where you encountered another provider that may have had a completely different treatment plan than what you intended for a patient? Maybe it was a consultant that you asked to consult before you on a patient. And how did you handle that sort of difference of opinion about what was the right direction to go, and just how did you manage that?
Certainly with cancer patients, there's a lot of complexities. And sometimes when we have consultants to help out with other comorbidities, and especially in teaching hospitals, there's a lot of the game of telephone between other members of the team. And sometimes in those communications, critical pieces of information about the patient are sometimes lost inadvertently, not on purpose, because everyone's trying to take care of the patient. But sometimes another team might have planned a different treatment strategy that didn't fully make sense to us as the primary team. But rather than, going, especially with the EMR, just going back and forth in messaging, sometimes it just takes a phone call, doctor to doctor, to be like, hey, can you just walk me through this? What's your thinking behind this, just so I know? And it might be that they have picked up something that you might not have, or vice versa, like, just so you know, they also have this going on, so maybe we need to modify this part of the treatment plan. And a lot of it can be talked through in a collegial way, but for the good of the patient, because ultimately our goals are aligned, and it's just getting on the same page a lot of times.
Yeah, I totally agree with Kenny. I feel like the conversation is so important because you both want great outcome, and you're probably each bringing important things to the table that'll result in a better treatment plan. And when the team plays telephone, so much misunderstanding when really your intent is so good.
Yeah.
It seems like in this discussion that curiosity also plays a role, right? Because you're approaching the situation not with judgment, with a sense of curiosity. So why do you think differently about this particular thing?
Yeah.
And so approaching it that way, I think is really helpful. And also, the other thing I heard in your conversation is that you're also establishing up front what the goal is, right? Up front, we both want the best for this particular patient. Mm-hmm. You know, we might have different views on how to get there. Let me understand your viewpoint and where you're coming from.
Yeah, I would say no one really responds well, like if they perceive that they're being attacked. And so exactly like you say, that approach of curiosity helps kind of open up the doors, open up the lines of communication to get to the common goal.
We do see this a lot in the hospital setting where not even just between two physicians, but let's say there's multiple consultants. It's really, we're having a hard time getting to the goal to just briefly get everybody together on the same page. As busy as everyone is, it is remarkable how efficiently we end up solving things rather than people just saying the same thing to each other over and over again. Super inefficient. It's almost better to just spend the time, talk it out, and move on.
It is interesting, right? Because of the age of texting and everything else, we just don't pick up the phone as much as they probably should.
Yeah.
Yeah, it's interesting because I tell my residents and fellows in this day and age, there are things that you can text for, there are things that you can email for, and there's definitely things that you need to call for. And part of it nowadays is understanding what level is what and what is the criticality of the piece of information that you have to communicate.
Yeah, texting always gives me a little pause because you don't know necessarily, unless the person responds to you, you don't really know that they've gotten it.
Mm-hmm.
Yep.
And even if they got it, is what you intended to say, what they had deciphered from that text. So it's, to me, it's actually more curious. I really like the whole readback mechanism when I'm talking to somebody, even if it's on the phone. Tell me what you heard, because, you know, even though I think I'm a clear communicator, sometimes I'm really not a very clear communicator. Let's talk about ABOG staff.
Yeah.
You know, we have an amazing staff here.
Best of the best.
50 employees, and they, I think, very much see the purpose of what we do, right? They know that we're trying to keep women safe, and I think to a fault, almost everybody that works here could actually do that, tell the mission, and then talk about, you know, the ways that we go about doing their work every day. So they really relate to the mission, and they try hard and they do great work. You've been here 8 months and 6 months respectively, more or less, give or take a little bit. And we've seen great things from our diplomates and candidates that are super complimentary. And then we've had some bumpier interactions. What kind of message would you like to share with the listeners today about those interactions and, you know, what kind of comportment might be good to have?
Yeah, you guys know I have feelings on this. We field a lot of phone calls and messages from our candidates and our diplomates, and what we do at ABOG is high stakes. Like board certification is high stakes, and as ABOG, we have a duty to maintain our high standards for our profession as well as for our patients. But within that context, for all of us, including us as well as our candidates and diplomates, professionalism still remains integral into who we are and what we do in all of our interactions. And admittedly, even our staff who are great that field the phone calls, they also approach it with like, okay, there's probably a lot going on. This is very stressful. How can I help you? But, you know, we've had fairly unprofessional interactions that they've had, unfortunately, even though they're trying to help them. And we want to support all of our candidates and diplomates as much as possible, short of, you know, taking their exams for them. And a lot of times that requires a call from me to be like, well, let me understand your situation. Was there some other reason for this unprofessional interaction? Is there other stuff that we can help you with, or anything I can specifically answer to you about? And often with that phone call, they'll really appreciate it. And then a lot of times there's other stuff going on that wasn't as apparent on the initial call or the initial messaging. But I would say, as people who are candidates and diplomates for us at ABOG, including us, we're diplomates of ABOG, just maintaining that professionalism. There's real people that work in the building here, and everyone, I would argue, that works inside our building is here because they believe in women's health and OBGYN as a field, and wanting to support and maintain our high standards and evolve our specialty in the right way. And so just knowing that we have those goals aligned, just maintaining that professionalism to our staff as well as to us, because we're here literally just trying to help everyone and trying to support everyone and to be as transparent as possible. But with especially our staff, they're real people and they're trying to help you out. So just treat them like you would other people.
Yeah, that's such an important point.
One of the things that we take for granted is that having, trained to be an OBGYN, having practiced being an OBGYN ear specialist or subspecialist, we have something in common with the diplomates and the candidates, right? So we firsthand have experienced what they're going through in some capacity. For our staff, sometimes even explaining that's not the same thing. I know my parents have talked about what it was like for me to live with them during my first 2 years of med school, and then I've had my husband that's actually sort of lived on the sidelines, and he'll be the first person to say that it's really hard to understand some of the things that people are going through because you haven't actually had that experience of those individuals.
Absolutely.
So, but I think our staff is really amazing, and I think they really do try to approach everything with curiosity, and I think they have this purpose at the first and forefront that they're helping this individual, so this individual can actually help patients. And so that's, I think philosophically, what we try to do at ABOG to support the diplomates. And so I think we're just asking for sort of something similar in return.
I think also want to bring up the fact that our diplomates and candidates' feedback is incredibly important, and that we learn every day from feedback that we get. And as long as people remember there's a human being on the other end of the line who really wants to learn from what they're experiencing and continue to drive ABOG to be better and better and better over the course of the future, just remembering it's a human who's receiving your message, and so just deliver it in a way that a human can appreciate and take the real nuggets out of and do something with.
So we just have a couple minutes left. And Kenny, I'm going to start with you. If there's one message that you want to leave with our listeners today, what would it be?
I would say this is a really, really critical time for OBGYN and the subspecialties. And we, as well as everyone here at ABOG, the board of directors, are trying to continue to improve, but to also have good stewardship for our field, to evolve and modernize things, but in the right way, so that we lead the field in the right way. As we know, there's all these external factors and things that are happening, and if we're not careful, we'll get into a situation where we may not want to be as OBGYN practitioners. So I would say that we're here to maintain our high standards for our field, for our diplomates, for our patients. We're here to support them as much as possible, and we're here to help guide us into the next evolution of whatever that is in the best way possible.
Thanks. I have one thing I want to add. I think sometimes, because we're a certifying body, and so what we do is a little scary and institutional, I think people forget that we want actually people to do well. So the reality is that help that all of our team provides to individuals is we want people to do well in their certifying exams. The qualifying exam, the certifying exam, we want them to maintain their certification. One of our goals is about mastery, right? And so helping our diplomates, and then our candidates, which will be future diplomates, be as good as they can be is our goal, because ultimately that's going to, translate to better care for patients. And, learning and being professional in the workplace is, a huge component of that, right? So it's not just about knowing the anatomy, physiology, management. It's really about this comportment that is going to further the care for that individual patient or populations of patients in front of you.
I do want to go back to my assume good intent message, because I think for almost all of the domains that you spoke about, that's such an incredible thing. And even we know that healthcare and administrative tasks that surround healthcare are a pressure cooker. We know that deeply as physicians. Every day is incredibly hard. And I think assuming good intent helps us to just like take a bit of a pause, give a little bit more grace than we would initially want to do, and just helps us deliver the healing that we're trying to do.
So having said that, I'm going to wind us up. So this has been Dr. Amy Young, the Executive Director of the American Board of OBGYN, and this is Talking Women's Health, and we look forward to seeing you next time.